Hi, I'm Arun George, and you're listening to Three Things, the Indian Express news show. In today's episode, we're looking at what the recent results of a survey for COVID-19 reveal, what is herd immunity, and whether we can achieve herd immunity against the SARS-CoV-2 virus. On the 21st of July, the government released the findings of a survey conducted in Delhi by the National Center for Disease Control. The survey involved the collection of over 21,000 random blood samples from across 11 districts of the capital. The findings of the study indicated that there was a positivity rate of 22.86% for the IgG antibodies. The government said that this indicated that over 77% of the city's residents remain at risk from the SARS-CoV-2 virus, and that rigorous measures to enforce containment zones were necessary. Similarly, data from over 9,000 samples tested for antibodies in two private labs in Mumbai showed that over 24% of those tested had antibodies against the virus. Similar surveys have been done in other parts of the country as well to try and understand the spread of the disease. But what is a serological survey, and what does it tell us about the spread of the disease? Also, what does it mean if more people than expected have contracted the virus? And if many people get the virus, does it give us what is known as herd immunity? We're now speaking with the Indian Express's Amitabh Sinha, who writes on science and has been tracking the spread of the virus in the country since the start of the pandemic. We started by asking him, what is the serological survey and who is it carried out on? Amitabh says these tests are very different from what is carried out on patients who show symptoms of COVID-19.
Okay, so these tests are slightly different from the tests that we generally hear about. Those are the diagnostic confirmatory tests, which are done on, say, nasal swabs or throat swabs. And those are the tests to find out whether you are currently infected or not, whether the virus is present in the body right now or not, whether you are sick right now or not. So that has a very different purpose. That's very specific to finding out whether you are infected right now or not. This particular test, the serological tests, are a different set of tests. They are done on blood samples, and they are looking to determine whether in any time in the past 3 or 4 months or 5 months, whether you were infected by this particular virus or not. Now, the antibodies, once generated, they remain in the body for a few months and depends from disease to disease, but usually they remain for maybe 6 months or more. So if you detect these antibodies during this time and you find that these antibodies are present, you can safely deduce that during the last few months, at some point of time, this person would have been infected with a virus. So this is a very different sort of test. And you are asking a very different question. Your investigation is very different. You are asking whether this person had ever been infected or not, rather than asking whether this person is right now infected.
But what are antibodies? And why are these tests and surveys being done for them?
Antibodies basically are some chemicals that are released by the immune system. Basically, these are proteins which are generated by the immune system in order to fight any disease. So whenever any foreign organism like a bacteria or a virus tries to enter the body, once the infection happens, the body actually, there is an autoimmune system, the body responds to it, and in response, these antibodies are released and they fight the disease. And when there is any further attack, in future, these antibodies would be able to prevent that. So the antibodies are very, very specific to a disease. The antibodies for this COVID-19 would be very different from antibodies that would be produced in a different disease, right? So they're very specific, and these are very telltale signs. Once you know which antibodies are produced, if those antibodies are present, then you know exactly that particular disease had already occurred.
So now we have the findings of the serological tests in Delhi, and it says that 23% of all those who have been tested have antibodies against the SARS-CoV-2 virus. And that number is now approximately 45 lakh is what is being said. But what does that mean then?
Okay, so before that, let's also try to understand, why do you do serological tests? I mean, why do you need to know whether this person or this group of people, whether they were infected or not in the past? So the problem with any of these epidemics, it's not possible to test everyone. Test as in do the diagnostic tests. It's not possible to test the entire population to know whether they are currently infected or not. So what happens is you are testing only a small group of people, people probably who are showing symptoms, who are reporting sick. Only those people are being tested, and then you find out whether that person is infected or not. But this disease and many other diseases like it are also asymptomatic in the sense that a lot of people don't show symptoms. They do not know whether they are infected or not, and there is no way to find out whether they are infected or not. But even as they remain asymptomatic, they are able to transmit the disease. Scientists and even the government's health authorities, they don't know what is the extent of the disease, what is the prevalence of the disease in the community. And you need to know that particular thing. You need to know the exact prevalence to take a lot of decisions, to decide on the interventions, for example, also to decide on, like in India's context, for example, decisions like when to impose the lockdown, what areas to block, and those kind of things. This test, the serological test, is not biased that ways in the sense that you try to test a random set of people, completely random set of people, and then you see whether they had antibodies or not. And a certain proportion of people would show antibodies, and then, like you do with any sort of survey, you try to extrapolate those findings for the entire population.
Earlier in May, the Indian Council for Medical Research did a similar serological survey and analyzed the findings from 65 districts with a varied number of COVID-19 patients. That survey said that less than 1% of the 26,400 people surveyed had antibodies to the SARS-CoV-2 virus. Given it was looking at cases a little over a month after the lockdown, here's what Dr. Balram Bhargav, the Director General of the Indian Council for Medical Research, had to say.
This means that the lockdown and the containment measures have been successful in keeping it low and preventing rapid spread of this disease over the last 3 months as we speak.
In the case of Delhi, the survey, which found a positivity rate of 22.86%, was conducted in the third week of June, when the number of cases was rising exponentially.
Now, that result can be extrapolated to say, okay, probably this is the extent of prevalence in the larger community. Now, here is where scientists say there has to be a little bit of nuancing in how you interpret these results. Yes, of course, there has to be a little bit of extrapolation because, again, you can't like test everyone even for the antibody tests. So, because you have a random set of people as against a biased set for diagnostic tests, wherein you are only testing a certain targeted group of people who are showing symptoms, this one is much more random and probably a more representative of how many people in the population or in the community have this infection.
An extrapolation is taking a set of known data points to estimate a data point that lies outside the range of existing data. For example, if your salary has been rising consistently year on year, then after a certain period, you can start to extrapolate what your future salary might be. But there are many factors that can influence this prediction, like an economic slowdown or sudden growth that in turn could affect your prediction. And that's what Amitabh says we need to be careful about with this extrapolation as well.
What we have to be careful about here is that this is an estimate. This is an extrapolation from a result that we have got from the serological tests. These are valid extrapolations, but we have to realize that this is just extrapolation. You cannot say with certainty that yes, 45 lakh people have been infected. And that's because the disease is not uniformly spread across the population. Right? Like if we talk about India's case, we all know there are pockets in which the disease is more widespread, and there are other areas in the country where it's not that widespread. And it's similar for small population groups and small areas as well. Delhi entire population is not uniformly at risk from the disease. right? So the extrapolation, like it is true for any other similar survey also, the extrapolation has to be careful, judicious, and not an overarching sort of an extrapolation. That's the only caution that there is with this kind of result.
But though it's an estimate, it's a useful one that helps policymakers decide what to do next. Amitabh cites the example of a number we've been tracking actively.
We often talk about how lethal this virus is, how many people are dying, and then we use a metric called fatality ratio. How many people are dying out of those who are falling sick? So, if the virus infects 100 people and there are 5 people who die, then we say there is a 5% fatality rate. Now, the thing is, this 100 people that we talk about that have been infected with the virus, those 100 are only people who have been tested and they have been found to be positive cases, right? But as we saw earlier, there are a lot of people who are asymptomatic, have never been tested, they have never reported sick, but still might have been carrying the virus, right? So the fact is that the 5 people who are might not be out of 100 people who have been infected, but possibly from the 1,000 people who have been infected, only 100 of which we know about. We know only 100 because we have tested only 100, right? So we say, okay, 5% people are, whoever gets infected are dying. Now that's a quite high number, but when we say it's not exactly 5%, but the total number of people who were infected was 1,000, and of them only 5 people have died, then the fatality rate is somewhere around 0.5%. And then you make your interventions accordingly, you make your decisions accordingly. So those are the kind of decisions that scientists and health authority need to make, for which this kind of information is very valuable.
But there's another problem with antibody tests. Amitabh says having antibodies doesn't imply immunity from the virus.
Another inference that is being drawn is that these 22% people are therefore now immune against the disease. And the scientists caution us against making such inferences, mainly because they say there is a difference between having antibodies and having protection. In generic terms, if you have antibodies, antibodies are produced by the immune system and they are meant to fight the disease. It's generally considered that if you have antibodies, then you also have protection. Now, scientists tell you there's a difference, that it's not the same thing. Within the antibodies, there is a smaller subset of antibodies which they call neutralizing antibodies, actually. And this small subset of these antibodies, called neutralizing antibodies, are the ones which actually fight the disease. Right. The other consideration in deciding whether you have protection is the amount of antibodies that is being generated in your body. Both these things are quite crucial to decide whether you have protection against a disease or not. So, the mere presence of antibodies does not guarantee protection. What you have to further assess it to see whether you have neutralizing antibodies as well, and what is the amount of antibodies that is present in your system. Any serological tests, they don't go into these questions at all. They are not designed to do that. They only give you an answer to the question, does this person have antibodies for this disease? And they only give you a yes or no answer. That's it. They do not go into the quality of the antibodies, the fact whether there are neutralizing agents or not, and what is the quantity of the antibodies present.
Amitabh also says there are arguments against this survey because we're not clear yet whether patients who recover from COVID-19 can get infected by the virus again. While the number of documented cases of reinfection are still low, there's still insufficient data presently to say anything with complete certainty.
There's an argument against that as well. The argument against that is that till now there has not been any documented case of someone getting reinfected. So the mere fact that somebody has been infected earlier, and that is very well established by the serological tests, means that they also have immunity and that probably they won't get it again. But this is only present knowledge that no reinfection has occurred till now. That might change. That might change. We might discover people who might have been reinfected. There have been a couple of cases where such suspicions have arisen, but it's not very well established as of now that reinfection has been happening.
Before we get to the next segment, I just wanted your quick attention. One of the big reasons people say that they like this show is because it helps them understand the news better. It provides them with the context they need to see the bigger picture. And there's perhaps no other place that does this better than the Indian Express's Explained section. We on Three Things refer to the section regularly, and it helps us make this show. If you're a regular reader of the newspaper, you know how useful the Explained section can be, especially when you're looking for in-depth analysis by the right experts. You can log into indianexpress.com/explained and access their coverage 24/7. Explained by the Indian Express, where news that matters is explained by experts who know the subject. Now, back to the show. Just to quickly recap what we discussed in the previous segment, serological tests indicate the spread of COVID-19 but don't give us adequate information about things like whether a person has adequate antibodies against the virus. Also, antibodies does not equal immunity. The rising number of people contracting the virus in the country and having antibodies also raises questions about a phenomenon known as herd immunity. So this then brings us to the term of herd immunity, which we've been hearing since the pandemic hit. It's been used across countries. But what is really herd immunity? And is there any other kind of illness for which, say, our society has herd immunity?
All that the herd immunity means is, see, we are in an epidemic situation. The disease is getting transmitted. One person possibly transmits it to 2 or 3 more people. They in turn transmit to a few others. So how would this transmission stop? Now, one way of stopping this transmission is if there was, say, a drug that could stop it, or a vaccine, people where everyone was vaccinated, but we do not have a vaccine right now. Does that mean that everyone in the population will have before the disease, before this epidemic stops? Now you realize that it's not so. This epidemic actually, once, say, about 50% or 60% of the population does get infected. Now, after that, at certain point of time, and this threshold is different for different diseases, but what happens is once a certain threshold of the population does get infected, then the epidemic begins to slow down. There are diseases for which the herd immunity is achieved at 90%. And people often talk about measles, for example, which gets transmitted very fast. By the time the herd immunity is achieved, 90% of the population is already infected. Now, with this disease, it might be achieved a little earlier.
We asked Amitabh to explain herd immunity with an example.
Say, I am an infected person, I am carrying a virus, and if I interact with 10 people, then I can potentially transmit the disease to these 10 people, right? But that's only a potential. I do not transmit it actually to 10 people every time I meet. I might transmit it to 3 people, 4 people, might not transmit it to anyone else. So even that is possible. But because if I am interacting with 10 people who are uninfected, my chances of transmitting the disease is quite high. The chances that I transmit it to at least 2 people or 3 people is quite high because everyone that I am interacting with is uninfected till now. Right. So this is the initial stage of the virus wherein there is one infected person and he or she is interacting with lots of uninfected people. Therefore, the chances of they transmitting the virus ahead is quite high. Now imagine this cycle has been already been done several times for several generations, and that we are at a stage wherein a lot of people in the community are already infected. Now if I'm meeting 10 people now and 5 of them already had the disease earlier and therefore they are immune, so there are only 5 uninfected people that I can transmit the disease to. And therefore, my chances of transmitting the disease to those 5 people gets severely reduced. Right? So the potential carriers of the virus starts to progressively reduce in the population. So my chances of infecting someone further gets reduced. And therefore, if I am not able to transmit the disease to someone else, then that chain of transmission breaks. And those 5 people or whoever others that I've interacted with, probably they don't get that disease. And they are protected by virtue of the fact that someone else in the group or the people around them, they had already been infected and they were immune.
Nations like the UK were among the first to speak about developing herd immunity to the virus. In March, this is what the UK government's chief scientific advisor had to say in its defense in an interview on Sky News.
And also allow enough of us who are going to get mild illness to become immune to this, to help with the sort of whole population response, which would protect everybody.
The UK subsequently saw the number of cases and deaths spike and prompted the government to impose lockdowns. Amitabh says there's one huge problem in trying to achieve herd immunity.
What we don't know as of now is, for this disease, what is the threshold percentage? Would it kick in, say, at around 60% or 70% of the population? We really don't know. And why we don't know is that this epidemic is still in progress. Typically, these kind of estimates about when the herd immunity had kicked in, usually it's much better assessed once the epidemic is over. When the epidemic is still in progress, there are lots of parameters that go into making this estimate, which are very dynamic parameters. These are evolving, these are changing parameters, and therefore it's very, very difficult to know exactly at what point the herd immunity will kick in. There are other things also we need to know. Herd immunity kicks in population which is sort of closed. It is isolated. It's not interacting with another population. And this has nothing to do with, your city boundaries or your country boundaries or a state boundaries. Whatever population group that we are looking at, that population group has to be isolated from other population groups for any meaningful discussion on herd immunity. If there are people who are coming in and out, people from that particular population group are going out and mixing with others are coming in, then, it becomes all the more complicated discussion on herd immunity.
So you can't basically say that, look, say a Bombay or a Delhi has achieved herd immunity. It wouldn't allow for that sort of, say, a bubble of travel or sort of safety in that sense.
Let's say from the serological surveys in Delhi, for example, the kind of inferences that are being drawn is 45 lakh people maybe in Delhi are already infected. Delhi has a population of about around 2 crores, which means about 25% of people are already infected. And then probably in another, say, whatever, people are speculating on that period as well. Say in a month's time, maybe another few lakh people are infected. And then maybe 50% is reached in another month or so. And after that, a herd immunity will kick in. There are several ifs in each of these assumptions. We do not know. So that kind of inference is problematic as of now, to say that because the serological surveys have showed 22% people having already been infected and that this is rising, and that therefore probably right now there are 40% people in Delhi who have been infected, and once 50% is reached, we would probably have reached a stage of herd immunity. Now, all this right now is speculation. These kind of inferences are very weak on science as of now.
So does this also mean we could see more spikes when it comes to cases and deaths? I mean, in places like Mumbai and Delhi, as well as even as a nation before this sort of herd immunity kicks in?
Yeah, it's possible. It's quite possible. Like, one thing that is certainly happening in Delhi right now, and it looks quite evident from the numbers that are being put out by the state government, that there was a stage about a month ago when Delhi was reporting many more number of cases every day, and those numbers have come down, right? So from a stage wherein Delhi was reporting about 3,000, 3,500, even up to around 3,900, 4,000 cases a day, those figures have come down to say around 1,200, 1,300. But that does not mean that there won't be a spike anytime in future now. Right now, we do not know, and it is too early to say whether Delhi has already reached a peak and that the disease has begun to decline. That kind of statement or that kind of conclusion is very premature right now. In fact, that kind of assessment cannot even be made on the kind of data that is released to public. That data which every state government puts out in public domain about how many cases happened yesterday and how many tests were carried out and how many people died, that data, it's an indicative data, and it's good for making certain kind of reading trends and looking into different indications of where we are headed. For that purpose, it's fine. But that data is not clean data. That is a corrupted data in the sense that it also includes cases from different days, deaths from different days, and there are lots of problems with that data, wherein researchers and scientists need to look at raw data to see whether the cases have actually begun to gone down and the disease has started slowing down. So it's too premature to say what is happening in Delhi is actually a slowing down of the disease. There can be a surge. We have seen such things happening in other states. Andhra Pradesh is the latest example right now. I mean, the Andhra Pradesh situation looked very much in control, say, a month and a half earlier. And suddenly there is so much of surge happening. And it's the fastest growing state in the country right now. Similar things we have seen in Tamil Nadu, even in Karnataka, for example. Other states like Bihar and Odisha also, every state has had these phases wherein the cases grew very fast. Then there was a period wherein there was a relative lull. And then again, things have started to go up. So these are normal progressions of epidemic, nothing to be surprised about. But whether the disease has reached its peak and has begun to decline, that's a very, very scientific assessment. And such assessments is very difficult to be made right now.
So, supposing, like, say, I live in Delhi right now, and at some stage we have herd immunity. If a vaccine is developed by, say, the first half of 2021, as they're saying, does it mean I don't need to take it if there's herd immunity?
Herd immunity does protect you. Yes, there's absolutely no doubt. But you don't have a personal protection. So herd immunity still keeps the option open that you are still vulnerable. It's just that you are being protected by chance because everyone around you probably has been infected, and therefore the chain of transmission is breaking, but you continue to be vulnerable. The chances that if you do meet a person who is infected currently, then you don't have any protection. You are protected by chance, but you don't have a guaranteed protection. The vaccine is something that gives you a guaranteed protection. Right. So if you have the option of a vaccine, then of course the vaccine is a better choice.
You were listening to Three Things by the Indian Express. Today's show, as always, was edited and mixed by our producer Joshua Thomas. Before we go, here's another reminder to check out Indian Express's Explained page. You can log on to indianexpress.com/explained and find in-depth analysis by the right experts. It has everything you need to know and understand the news better and see the bigger picture. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it. Share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet to us at Express Audio and write to us at podcasts@indianexpress.com.